Welcome to the course of Mind Sciences. I am Amresh Shrivastava, Psychiatrist. The college period is a crucial developmental phase with challenges in academic, social and personal domains. Mental health issues are prevalent among college students, often exacerbated by genetic and psychosocial, psychological and social factors. Reports worldwide indicate higher rates of depression, anxiety, substance use, and use of illicit drugs amongst students. If we see the pattern in late adolescence and early adulthood, they witness a greater incidence of severe mental illness also, with estimates suggesting 75% may experience significant symptom by the age of 25. Suicide rate higher in college students, with global estimates of suicidal ideation, plans, attempts. And we know in India, more than 15,000 students die due to suicide every year. And more than 1.5 lakh make an attempt and get admitted in the hospital. Mental health issues are associated with physical inactivity, unhealthy diet, and risky behavior. Yes, counselors. We often talk about them. School counselors. Government has made it mandatory, but we have very limited number of training facilities for school counselors. School counselors can facilitate scholarship, academic support, and connect students with support groups. Those with severe mental illness, substance use issue, and high suicide rate should have timely access to off-campus mental health care. A stepped-up care approach. Now this is a problem. How do we provide care to our students? Phase-wise manner, stepped up, within the school or the university, or outside, in the hospital or in the psychiatric center, within the homes, within the families. There are a number of issues which have been debated world over in number of model of care, conferences and position papers that are available for all of us to read. And number of recommendations are available. The best is support and care when it is needed. So when the children and adolescents are in school, the teachers are their first counselors, and therefore all teachers need to be provided mental health education, as well as they need to be skilled in providing the kind of care and counseling that is necessary. It is a matter of great concern that teachers are the first counselors and they must be trained. I know everybody hates training, nobody likes to hear about it, but it's unavoidable. If you do not have the skills to change yourself and become from a teacher to a counselor, it will be very difficult to understand the emotional difficulties of children and adolescents. The viewpoint argues that establishment of comprehensive mental health services in colleges, emphasizing prevalence of mental health issues among students. The college period is crucial, no doubt, but it is also the period where personality is developing, biology is changing, transition is common, challenges are common, new learning occurs, cognition is developing, emotional quotient is evolving, and spirituality is taking roots. Viewpoint and existential viewpoint is also being imbibed on your mind. This is a versatile period, and an awareness about what can happen is more important. Unless you know that stress can transform an at-risk person into a florid anxiety, or if you know why a child is refusing to climb 6th floor or going in a lift, you will not be able to help him. The anxiety, the phobia, repulsion, anger, fear, hopelessness, All these minor traits of psychology are building up, they are taking shape, they are concretizing in this age. Before they get firmly rooted into the personality, it is important to recognize. I think a great amount of psychological therapy in form of group therapy is required in the schools. The minimum and the best a school can do is to sit down and have open discussion about mental health every day for half an hour, for 1 hour. Children do not have opportunity to speak. They are not able to express. We need to understand the language that they speak, whether they speak via body language in form of pain here and pain there, or in form of a change in behavior by becoming more demanding or becoming more rowdy. Each and every condition needs to be understood. They are trying to communicate. They are trying to communicate that they are changing. They are getting adult and bigger. They are becoming a citizen of such a big society, and they are scared. They don't know. There is confusion. There is fear. We have no mechanism to deal with these situations in the fast pace of life, where every minute is more important than the previous minute. We are losing connect with people's mind. People are afraid about losing their mind. People are afraid about developing psychiatric problems. They are unaware about where to go and what to do, and suddenly, impulsively, something happens and we get shocked. It's time to prepare ourselves. Empower yourself with education. Help your children.